I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and welcome to this video on how not to improve your health. Well, we all want to get better, get healthy, be fit, have a sexy body, all that sort of stuff. Who doesn't? If I gave you a magic button to press and said press this and you'll be lean, cut, physically attractive, I can't think of anyone who wouldn't press it. Everyone would press it. But in life, we press the opposite button. And this is a real life story to explain that. I had a young lady come in. She's been seeing me for several years. She's got what I call oil gland dysfunction. I used to call it oil gland disease because we used to refer to everything as disease. But there's a big difference between dysfunction and disease. Dysfunction, if I pour diesel into my petrol car or petrol into my diesel, the engine won't work. It'll be dysfunctional. It's not diseased. But that dysfunction from what I've done can cause damage, which is a disease state. So this patient came in, lovely lady in her 30s. She had horrendous oil gland dysfunction in her eyelid. It was formed a big lump and it was growing down and required surgical excision. I took it out. I had a long chat to her about dietary change because one of the biggest causes of oil gland dysfunction in our body is our poor diet. And I said to her, look, one of the things you could do, because they always ask me, because you don't want to be coming back for surgery, is change your diet. Make sure you choose foods that are less inflammatory. Now, I'm not a nutritionist. It's not my role here to tell you what to eat or what to avoid. There's a whole lot of information out there and you can find it. It actually makes a huge difference. But she said, yep, gave me a usual reply, yep. So I've seen her several times since, and each time I ask her the same question. How are you going, miss? Whatever her name is. And she'd look at me and go, oh, all right. Have you changed your diet? Oh, I'm trying. Well, she came back in with another lump and asked me to remove it. And I asked her the same question. Have you changed your diet? Oh, I'm trying. It's difficult. So she gets all the usual foods that you can have home delivered. Let me put it that way. Anyway, just as I was about to prepare to drain it, I turned to write my notes and I heard a slurping sound. And I thought, what the hell is that? Turned around and there she is drinking a full strength soda, complete with sugar, about 80 grams. And she's drinking it through a straw, finishing it right in front of me, right after I'd asked her, how are you going with your dietary change? Mind you, she's quite obese. So all this together, and it's no wonder that she's getting recurrent oil gland dysfunction. She comes to me, I'm not treating it, I'm simply terminating some of the acute presentation of oil gland dysfunction. I'm not treating her oil gland dysfunction. I'm making it less visible by getting rid of lumps that show up. And I looked at her and I thought, why aren't you helping yourself? I can only do so much. Anyway, so I fixed it, she's happy. But it made me a little sad because she hadn't quite got the message. And there's very little I can do to help her. She's got to take the first step, which is most things in life. Take the first step. And with oil gland dysfunction, most of it is related to food. Now, there are other causes. You can have metabolic conditions. You can have hormonal conditions and other disease states. You could have problems with skin flora. Fungi can trigger oil gland dysfunction. There's a whole lot of other causes. But in the end, why don't you take the first step? Change your diet. I hope that all makes sense. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney.